Imagine for a moment a man named Arthur. Arthur is 72 years old, but if you spoke to him, you would think he was 50. He is a retired engineer, a man who spent his life solving complex structural problems. He is the person his grandchildren call when they need help with their calculus homework. Arthur has always been the pillar of his family, the one with the sharpest memory and the quickest wit. But one Tuesday afternoon, something changes. Arthur is driving home from the grocery store, a route he has taken at least 4,000 times over the last 30 years. He pulls up to a stoplight, looks at the street sign, and suddenly, the world turns unrecognizable. He doesn't know which way to turn. He doesn't recognize the park on the corner where he coached his son's Little League team. For 20 minutes, Arthur sits in his car, gripped by a cold, paralyzing terror, until a police officer knocks on his window. When Arthur's family hears about this, they do what most families do. They sigh, they exchange worried glances, and they whisper the words that every senior fears. He is just getting old. They assume his brain is simply reaching its expiration date. But they are wrong. Arthur's brain wasn't failing because of his age. It was failing because of a small blue pill he had been taking every night for 3 years to help him stay asleep. I am Dr. Ethan Cole. After nearly 2 decades in clinical practice, I have seen Arthur's story play out in 1,000 different variations. I have watched brilliant minds flicker and dim, not because of an unstoppable disease, but because of the very medications prescribed to help them. Every 66 seconds, another senior in this country receives a diagnosis of dementia. By the time you finish watching this video, 20 more families will have their lives upended by those words. And for a staggering number of them, the cause isn't genetic, and it isn't inevitable. It is a chemical thief sitting right inside their medicine cabinet. Today, we are going to pull back the curtain on a hidden epidemic. We are walking through the 9 most common medications that have been scientifically linked to rapid, preventable memory loss. We will count them down from the common household names to the one medication I consider the single most destructive force against the aging mind. I want you to pay special attention to number 3. It is a drug handed out to millions of people for a condition that seems completely unrelated to the brain, yet it may be silently shrinking your memory centers as we speak. Before we dive into the science, I need to ask you something. Please, go to the comments right now and tell me your age and which daily medications you are currently taking. I read these comments personally. Understanding the demographics of this community allows me to tailor the medical research I present in future videos to serve you better. Let's begin our countdown with a drug that is likely in your house right now. We start at number 9 with a substance called diphenhydramine. You almost certainly know it by its commercial name, Benadryl. This is the pink pill people reach for when they can't sleep, when their seasonal allergies flare up, or when they feel the itchy onset of a cold. Because it is sold in every gas station and grocery store in the country without a prescription, there is a dangerous universal assumption that it is harmless. People treat it like candy, taking it night after night to take the edge off. Inside your brain, however, diphenhydramine is anything but gentle. It belongs to a class of drugs known as anticholinergics. To understand why this is a problem, you need to understand a chemical called acetylcholine. Think of acetylcholine as the electricity of your mind. It is the primary neurotransmitter your brain uses to transmit signals between neurons. It is responsible for your ability to focus, your speed of processing information, and most importantly, your ability to lay down new memories. As we age, our brains naturally produce less acetylcholine. We become more dependent on every single molecule we have left. When you take a drug like Benadryl, you are essentially sending a chemical blockade into your nervous system that shuts down this vital messenger. In a 30-year-old brain, the system is robust enough to bounce back. But in a 60 or 70-year-old brain, this blockade is devastating. I remember a patient I will call Mrs. Gable. She was a vibrant woman in her late 60s who began complaining of brain fog. She told me she felt like she was living underwater. She was forgetting her bridge club appointments and struggling to follow the plot of the books she loved. After a long conversation, I discovered she had been taking a nighttime allergy pill containing diphenhydramine every single night for 5 years, just to help her fall asleep. She never thought to mention it because it's just an allergy pill. The research is terrifyingly clear. A 2023 study published in the Journal of Geriatric Cognitive Health tracked older adults using these types of drugs regularly. They found a 54% higher risk of developing full-blown dementia compared to those who avoided them. That is not a small margin. That is a massive spike in risk for something most people consider a minor household staple. The specific area that takes the hardest hit is the hippocampus. This is a small, seahorse-shaped structure deep in the temporal lobe that acts as the brain's librarian. It takes incoming information and files it away into long-term storage. When you starve the hippocampus of acetylcholine, the librarian goes on strike. Information comes in, but it never gets filed. This is why you can have a conversation with someone and forget it entirely 20 minutes later. If you are using an allergy medication, look for the non-drowsy label. Newer generations of antihistamines, such as loratadine, which is sold as Claritin, do not cross the blood-brain barrier the way the older drugs do. They stay in the body to fight allergies, but stay out of the brain. If you are taking it for sleep, we need to find the root cause of your insomnia rather than sedating your neurons into submission. Never stop a medication abruptly on your own, but you must stop assuming that over-the-counter means brain safe. Number 8 on our list is a class of drugs your stomach may love, but your brain quietly pays a heavy price for. These are the proton pump inhibitors, commonly known as PPIs. You know them by names like omeprazole, esomeprazole, or by their brand names, Prilosec and Nexium. They are the gold standard for treating chronic heartburn, acid reflux, and GERD. They work by effectively turning off the acid-producing pumps in your stomach lining. Because they provide such immediate relief from the burning pain of reflux, people tend to stay on them for years, and in many cases, decades. The problem is that your body was never designed to function without stomach acid. Acid is not just a digestive waste product, it is a critical tool for extraction. Specifically, your body requires a highly acidic environment to pull vitamin B12 out of the food you eat. Vitamin B12 is the primary protector of your nervous system. It maintains the myelin sheath, which is the protective insulation wrapped around every nerve fiber in your brain. When you turn off your stomach acid long-term, your B12 levels begin to plummet silently. You are essentially starving your brain's wiring of its most basic maintenance tool. Without enough B12, your neurons begin to misfire. This leads to confusion, mood changes, and memory slips that are often indistinguishable from the early stages of Alzheimer's disease. But the damage doesn't stop with B12. PPs also interfere with the absorption of magnesium and calcium, two minerals that your brain cells depend on to fire and signal cleanly. Furthermore, a landmark study published in JAMA Neurology involving over 73,000 seniors found that regular PPI users had a 44% higher risk of dementia. More concerningly, newer research suggests that these drugs may actually increase the levels of amyloid beta in the brain. This is the sticky protein that forms the plaques found in the brains of Alzheimer's patients. I often see patients who feel trapped. They say, "Dr. Cole, if I stop taking my Nexium, the heartburn comes back so badly I can't eat." This is known as the rebound effect. Your stomach tries to overcompensate for the drug by producing even more acid when you stop. This creates a cycle of chemical dependency that can last a lifetime. The move here is not to suffer in pain, but to work with a professional to taper down. Many people can successfully transition to a gentler class of drugs called H2 blockers, such as famotidine, which is sold as Pepcid. These do not have the same aggressive impact on nutrient absorption or brain health. Additionally, Natural alternatives like deglycyrrhizinated licorice, or DGL, can coat and soothe the stomach lining without shutting down your digestive chemistry. The goal should always be the lowest dose for the shortest possible duration. Your stomach might be quiet, but we need to make sure your brain isn't being silenced along with it. As we move to number 7 on our list, we encounter a category of medication prescribed for a problem that many people find too embarrassing to discuss openly. These are the bladder control medications, with the most common culprit being oxybutynin, often sold under the brand name Ditropan. This medication is typically given to seniors who suffer from an overactive bladder, a condition characterized by a sudden, urgent need to reach a bathroom. For many, this isn't just a physical inconvenience, it is a social prison. People stop going to church, they stop visiting their grandchildren, and they stop traveling because they are terrified of having an accident in public. When a doctor offers a pill that promises to calm the bladder, most patients accept it with a sense of immense relief. However, the biological price of this relief is staggering. Oxybutynin works by blocking the very same chemical we discussed earlier, acetylcholine. But unlike some other drugs, oxybutynin is particularly lipophilic, meaning it is fat-soluble. This allows it to slip across the blood-brain barrier with terrifying ease. Once inside, it parks itself directly in the memory centers of your brain. In 2019, the British Medical Journal published a massive study focusing on people over the age of 65 who use strong anticholinergic drugs like oxybutynin for more than a year. The researchers found that these individuals had a 49% higher risk of developing dementia. That is nearly a 1 in 2 chance that your bladder medication is paving the way for cognitive decline. The tragedy I see in my clinic is that the symptoms of this drug are almost always blamed on, quote, old age. A patient starts forgetting where they parked their car, or they begin losing the thread of a simple conversation. Their family notices they aren't as, quote, sharp as they used to be. Because these changes happen gradually over months and years, no one thinks to look at the bladder pill they've been taking every morning. I want you to know that you do not have to choose between your dignity and your mind. Modern medicine has developed newer drugs, such as mirabegron, sold as Myrbetriq. This medication works through a completely different biological pathway called the beta-3 adrenergic receptor. It calms the bladder without touching your acetylcholine levels, meaning it provides the same freedom without the cognitive cost. If you are on oxybutynin, please have this specific conversation with your urologist. Now we arrive at a pair of medications that are among the most frequently prescribed in the entire world. Number 6 is the class of drugs known as statins, such as simvastatin and atorvastatin, known as Zocor and Lipitor. Statins do an incredibly important job. They lower LDL cholesterol and have saved countless lives by preventing heart attacks and strokes. I want to be very clear. For many people, statins are a life-saving necessity. However, there is a half of the story that rarely makes it out of the doctor's office. Your brain is the fattiest organ in your body, consisting of nearly 60% fat. It requires cholesterol to function. Specifically, your brain uses cholesterol to build and repair the myelin sheath. Think of the myelin sheath as the plastic insulation wrapped around an electrical wire. Without that insulation, the electrical signals in your brain leak out, slow down, or short circuit. Some statins, known as lipophilic statins, cross into the brain tissue very easily and can aggressively lower the cholesterol levels that your neurons need for maintenance. A 2023 study in Frontiers in Aging Neuroscience found that adults over 70 on long-term, high-dose statins had a 26% higher rate of mild cognitive impairment. Patients often describe frightening mental blanks or feeling like their brain is misfiring. The good news is that not all statins are the same. Hydrophilic statins, like pravastatin and rosuvastatin, do not cross into the brain as readily and are generally considered much safer for preserving memory. If you feel foggy on your current statin, ask your doctor about switching to a more brain-friendly version. This brings us to number 5, the benzodiazepines. These include lorazepam, diazepam, and alprazolam, better known as Ativan, Valium, and Xanax. These are the chemical handcuffs of the medical world. They are prescribed for anxiety, panic attacks, and insomnia. They work by boosting GABA, a chemical that tells your nervous system to slow down and relax. At first, these drugs feel like a rescue. The racing heart stops and sleep finally comes. But a 2022 study in the British Medical Journal followed 8,000 seniors and found that using these drugs for longer than 3 months increased the risk of Alzheimer's by 51%. These drugs create a state of chronic chemical sedation. Over time, your mental flexibility disappears. You might feel emotionally flat, as if you are moving through life behind a sheet of thick glass. The most critical warning I can give you today concerns these drugs. You must never, under any circumstances, stop taking a benzodiazepine cold turkey. Doing so can cause seizures, severe hallucinations, and can even be life-threatening. These drugs must be tapered off very slowly, often over several months under strict medical supervision. There are safer ways to handle anxiety, such as buspirone or targeted therapy, that do not come with a 50% increase in dementia risk. Number 4 on our list is a medication called Amitriptyline, often sold as Elavil. This is what I call a Swiss Army knife drug because it is used for everything. It's an old antidepressant, but today it is mostly prescribed in low doses for chronic nerve pain, fibromyalgia, migraine prevention, and sleep. Because it is used for so many different things, it often flies under the radar. But amitriptyline is one of the most potent anticholinergic drugs still in existence. It blocks acetylcholine so aggressively that memory loss isn't just a side effect. For many seniors, it is an inevitability. A 2015 study in JAMA Internal Medicine showed that seniors with high exposure to these types of drugs over a 10-year period had a 54% higher risk of dementia. If you are taking this for pain, there are much safer alternatives like duloxetine or gabapentin that provide relief without the heavy anticholinergic burden. Finally, we reach number 3. I told you to watch for this one, and here is why. Number 3 is Paroxetine, sold as Paxil. It belongs to the SSRI family of antidepressants, which includes famous drugs like Prozac and Zoloft. Most people, and even many doctors, assume that all SSRIs are essentially the same when it comes to the brain. But paroxetine is the black sheep of the family. It is the only major SSRI that possesses strong anticholinergic activity. While drugs like sertraline or escitalopram are generally safe for the aging brain, paroxetine behaves more like the older, more dangerous drugs we've been discussing. A 2021 review in Frontiers in Psychiatry found that older adults taking paroxetine showed measurable declines in short-term memory and attention within just the first 12 months of use. They were 30% more likely to show early signs of cognitive impairment compared to seniors on other antidepressants. The American Geriatric Society has actually placed paroxetine on the Beers list. This is a formal registry of medications that are considered potentially inappropriate and dangerous for seniors. Yet, it is still handed out to millions of people for anxiety and depression. There is a painful irony here. A drug meant to stabilize your mood may be the very thing eroding your mental clarity. If you or a loved one are taking Paxil, speak to your doctor about transitioning to a safer SSRI that doesn't carry this hidden baggage. Supporting your mood shouldn't require sacrificing your memories. We now reach a category of medication that concerns me more than almost any other on this list, because many of the people taking it and many of the families watching them decline have no idea what the drug actually is. Number 2 is the class of antipsychotic medications. You may know them by names like quetiapine, risperidone, or olanzapine, which are sold under the brand names Seroquel, Risperidol, and Zyprexa. Originally, These powerful drugs were developed and FDA approved for very specific severe psychiatric conditions like schizophrenia or bipolar disorder. In those contexts, they can be life-saving. But today, we are witnessing a massive increase in what we call off-label use. These drugs are being handed out to seniors not because they have a psychiatric illness, but to manage behavioral symptoms. If a senior in a nursing facility or a home care setting becomes restless, or if they experience the agitation that sometimes comes with early-stage dementia, these drugs are often the first thing reached for. They are used to quiet the patient. In the medical community, we sometimes call this a chemical straitjacket. The cost of this quiet is the destruction of the mind. In 2022, a landmark study published in Lancet Healthy Longevity tracked more than 25,000 older adults. The findings were devastating. Seniors who were given antipsychotic medications for behavioral symptoms were 71% more likely to experience a rapid worsening of their cognitive decline within just 1 year. This happened even in patients who had no previous history of dementia. To understand why this happens, we have to look at dopamine. While the other drugs on our list mostly block acetylcholine, antipsychotics primarily suppress dopamine. Most people think of dopamine only as the, quote, reward chemical, but it is actually the fuel for your prefrontal cortex, the part of the brain responsible for focus, planning, and executive function. When you suppress dopamine in an aging brain, you aren't just calming the person down. You are turning off their ability to think, to reason, and to engage with the world. I have seen this in my own practice far too often. A family brings in their grandfather, and they are grieving because he has become, quote, a shell of himself. He is emotionally flat, he stares into space for hours, and he no longer recognizes the jokes he used to love. The family assumes the dementia is just, quote, taking over. But when we look at his chart, we find he was put on a, quote, low dose of Seroquel 6 months ago just to help him stop wandering at night. Beyond the memory loss, these drugs carry a black box warning for seniors because they significantly increase the risk of stroke, sudden cardiac death, and the kind of profound sedation that leads to falls and broken hips. If you or a loved one is taking an antipsychotic, you must ask the prescribing physician, why was this started? Is there a non-chemical way to manage this restlessness? Often, simple changes to lighting, daily routines, or treating hidden physical pain can calm a senior without erasing their personality. We have reached the end of our countdown, but number 1 is not a single pill. In fact, it is something far more dangerous because it is invisible to most doctors and completely unknown to most patients. Number 1 is what we call anticholinergic polypharmacy. This is the final boss of medication-induced memory loss. Polypharmacy simply means taking multiple medications at the same time. Anticholinergic burden refers to the combined, cumulative effect of all those medications hitting your brain simultaneously. Imagine your brain's memory system is like a rain barrel. Your body naturally keeps it filled with acetylcholine so you can think and remember. Taking one drug, like a PPI for your stomach, is like poking a small hole in the side of that barrel. You lose some fluid, but the barrel stays mostly full. You might feel a little off, but you function. But then you add a bladder medication. That's a second hole. Then you add a nighttime sleep aid. That's a third hole. Suddenly, the acetylcholine is leaking out faster than your brain can produce it. The barrel goes dry. This is when the rapid memory loss happens. This is when you find yourself standing in the middle of a room, unable to remember why you walked in there, or looking at the face of a lifelong friend and struggling to find their name. In 2022, a study published in the journal Age and Aging followed over 280,000 older adults. They found that those with the highest cumulative burden, those taking 3 or more of these types of drugs, had a 120% higher risk of dementia. They weren't just aging, they were being chemically overdosed into a state of cognitive failure. The reason this happens is a breakdown in our medical system. Your cardiologist prescribes a statin. Your urologist prescribes the bladder pill. Your primary care doctor gives you something for sleep. Each doctor is looking at their own slice of your health, but often no one is looking at the whole picture. No one is calculating the total weight of these chemicals on your brain. But here is the message of hope I want to leave you with today, and it is the most important thing I will say. Medication-induced cognitive decline is often reversible. Unlike Alzheimer's disease, which involves the physical death of neurons, the fog caused by these medications is often a functional problem. Your neurons are still there, they are just being silenced. When we identify the burden and carefully, under medical supervision, reduce or eliminate the offending drugs, the results can be miraculous. I have seen patients who were labeled as demented regain their clarity, their humor, and their lives within weeks of cleaning up their medication list. So, here is your 3-step action plan. Step 1, the brown bag test. Gather every single thing you take. This includes prescriptions, over-the-counter allergy pills, sleep aids, and even natural supplements. Put them all in a bag. Step 2, the medication audit. Schedule a medication review appointment with your doctor or a clinical pharmacist. This is a specific type of visit where you don't talk about your symptoms, you only talk about your pills. Ask them specifically to calculate your Anticholinergic Burden score. Step 3, the taper. If a medication is found to be high risk, do not stop it yourself. Ask your doctor for a deprescribing plan. Ask for the safer alternatives we discussed today, like switching from Paxil to Zoloft, or from oxybutynin to Myrbetriq. Your brain is a resilient, powerful organ, but it cannot fight a war on 10 chemical fronts at once. Give it a chance to breathe. Give it a chance to remember. I want to thank you for spending this time with me. This is a long video because this is a complex problem that deserves more than a 30-second soundbite. If this information has helped you connect the dots for yourself or a parent, please share it. Information is the only way we stop this silent epidemic. Tell me in the comments, are you going to ask for a medication review this week? I want to see those commitments because that is where the healing begins. I am Dr. Ethan Cole. Stay sharp, stay informed, and I will see you in the next video. But before you go, there is one more place your body hides its warnings. Your medicine cabinet is one place, but your hands are another. Did you know your fingernails can reveal warning signs of kidney issues, blood disorders, and even nervous system decline years before you feel a single symptom? Most people ignore their nails, but tonight, I'm going to show you the 4 specific signs you need to check for in the mirror. That is the topic of our very next discussion. Click the video on your screen now to see what your hands are trying to tell you.